and kind of start kind of getting us the beginning steps of getting started. That way we can make sure we stay true to the half hour. I know everyone's really busy. Um, but I wanted to just go ahead and introduce myself if you did not have not seen my name before. My name is Jenna. I serve on the TDS Health customer engagement team. And so, what my support offerings are is traditionally in the form of things like training, product knowledge. When we have new clients, so any of the current subscribers that we have on here, um, when we have new client purchases or expansion purchases from our clients, I traditionally walk through an onboarding process. So I may have worked with some of you directly. And so today, the focus is going to be on some of our content that can be supportive in your efforts for achieving nursing excellence. So I'm joined by my lovely colleague Shannon, who serves as a member of our sales team. Shannon, you want to go ahead and just do a brief intro of yourself?
Yeah, sure. Hey, everyone. I'm Shannon. I am a regional VP in our sales team, and I support our current customers as well as prospective customers within various states in the U.S. I'm located in very chilly Wyoming and just south of Yellowstone and Teton National Parks. If you've ever been here, it's a beautiful area. Looking forward to this session. Thank you, Jenna. I just wanted to mention that feel free to ask questions, put them in the chat, the Q&A, and we're happy to answer those as they go along. Jenna is giving kind of a broad overview of these resources and how our customers are using them. But if you'd like a one-on-one session or maybe to customize this more to your nurses and your institution, I'm going to go ahead and drop my email in the chat as well as Jenna's. You can reach out to us with some questions or to set up an additional time to learn a little bit more.
Thanks, Shannon. And yes, so Shannon, um, perfect introduction. So I pulled up our topics for today. And so to echo what Shannon's saying, today is really to serve as kind of an introduction to the materials. And so we will not be able to go in deep dive everything that could be used and how it can align with your group. So if that's something we need to do a little bit more of, we're happy to do more of a one-to-one style session to really pick out certain things that are of interest to you. Um, but wanted to make sure that you all could get a little idea of some of the content that we have to offer. Sometimes when you're, talking with people over email or you're, getting probably inundated with a lot of different vendors of different things, it starts to be a little bit difficult to keep track of who has what and what is what. So we like to host these sessions as a way to make that a little bit easier for you to get those introductions. So in terms of what we're going to talk about today, we'll have a little bit of a welcome and intro like we're doing, and then we will also be able to go into and talk about three particular products that we wanted to focus on today that may be of interest for those in the space. So we're going to look at and spend probably the most amount of our time in one of our resources called StatPearls. Um, we'll be focused on some of the offerings in there that align with the needs associated with those who are wanting their teams to achieve different certification, continuing education. And then they also have some resources in there that can be good for on the fly in clinical practice. So a point of care tool, some peer reviewed articles. So some material there that we'll be able to take a look at. And then we have two other products on here that are going to be more so something that it's a you can make what you need with it type of situation. And you'll see that when we get in there that these are going to be more visual focused content that is going to be a good place to build a foundation for maybe educational sessions you're needing to host with your group. So um, that's something I actually got to attend quite a bit of when I was an intern, when I was in my undergrad many moons ago. But I was rounding within a hospital and I would attend some of the continuing education or in-service processes that were held for the nursing staff there. And this could be something in terms of Ditki and Primal Pictures, the other resources we're going to look at today, as a way to maybe build up content for those. So if you need to host a session for your group and you want to have some type of visual elements of it, whether that's a dissection slide or a tutorial video, some flashcards, things like that to brush up on foundational topics and then even clinical topics, those are available to you. So we'll talk about those a little bit. And then at the end, talking a little bit about how these tools can be interconnected to you to really support the goals that you have. And then any Q&A and next steps that you may have. So um, very brief rundown of the material that we'll be talking about today. Shannon's going to be my superhero and keep an eye on the chat and any of those things. So if you have questions throughout, please do not hesitate to ask and check in. I can talk very fast and talk a lot. So I want you to interrupt me and ask me questions so we can make sure this time is really valuable for you all. Shannon, anything you want to add before I pop into StatPearls and kind of kick us off?
No, I think we're good to go.
Awesome. So, like I said, the first resource we're going to talk a little bit about is going to be a resource called StatPearls. And some of you may be familiar with StatPearls, heard of it before. We may have some current clients on the call that have access to some StatPearls content. So, the very quick little elevator pitch about StatPearls is that their policy and messaging, their motto is content is king. So they are really focused on making sure that there's a breadth of material within one resource, kind of that one-stop shop element, which I know that is becoming further and further achievable based on the needs of different institutions. But the focus here was to create a resource where you could research material, study for a certification, maybe you could take some continuing education, and then also look at some additional material that may support you, whether that's in clinic or if you're doing actual self-study, reviewing a case, things like that. So for you all, we wanted to focus specifically on the certification options that are in here in terms of question banks, some continuing education activities, and then also how these things can be utilized for your team in practice. So my account, I have access to all of the content within StatPearls, but if you were to utilize it, it would look something similar to what I'm showing. But I want to point out that you'll see that we have a little dashboard over here on the left where we've got question banks, CEs, and articles. So those are kind of the three main disciplines we'll take a look at. But before I hop in there, I want to point out that we have this search bar here in the center of the dashboard where you can do searches for drugs, diseases, procedures, looking for certain keywords and phrases and certain questions that are within StatPearls, as well as some clinical tools over here that include things like algorithms, drug interaction checkers, calculators, things like that. So really serving as a point of care tool in practice. So maybe something that could work really well as a point of reference for your team as they are working through things, whether that's, like I said, in clinic or in their own time. We found that this worked really well because people who are studying for their certification banks in here or they're completing a CE activity, they get comfortable coming in here. And so when they want to look for something or something's on their mind, they have the ability to use this point of care tool and be able to make searches. So if they wanted to look for something and see in terms of what we have within StatPearls, they can make searches, they'll get details as to what the content is, the articles that we have available, a little summary here at the top, and then some recommended readings and details that they can take a look at. So in addition to that point of care style tool, we have those three other facets that I had pointed out. And so within those specifically, we have the three disciplines of question banks, continuing education activities, and then also articles. So the question banks are going to be exactly what you think of, is that these will be a collection of question banks that can be used to support for your team who's looking to achieve different certifications. So we're seeing a really large increase in our clients who are wanting to really do what they can to enhance the professional development of their nursing. So they are trying to find content that if they have nurses that are looking to achieve that critical care certification or bariatric care certification, that they're able to have something to do and to utilize in preparation. So I just completed a webinar with actually a nurse practitioner adult gerontology program. So they're using this content more on the educational side, but if I was to looking here, I have other content in here that I can utilize for support. So we have a large collection of different nursing certification banks. Um, so if we can provide you with a kind of a complete list, or at least a larger scale list of than what I can show here, because it is quite extensive.
And just to hop in real quick, there should be 71 question banks related to RN certifications, covering anything from critical care to peds to oncology and pretty much anything else. And it's great for some of that kind of cross unit training or going into a new specialty, as well as what we have found for new nurse remediation as well, just kind of gauge where they are in their level of knowledge as they're coming into the hospital and maybe areas to improve.
Awesome. Thanks, Shannon. There will be a quiz at the end that it's 71, so just preparation for everybody that you have to know that. So I've gone ahead and selected the critical care bank. So just to kind of give you an idea of what this looks like from a user perspective, if I'm going in here to take questions within this specialty, I can adjust the type of quiz I want to take, whether it's more of a study mode versus a test mode where I don't get answers and explanations until the end. It's really to kind of focus and study. And then you can make specifications depending on difficulty level, age range. We've got different topics in here that you can move through and decide. You can search for keywords or phrases in the questions to see if there's material you want to study. And then also, we can align the questions with some of the articles that are in here, which I will show you. So, um, the takeaway here is that you can utilize these banks in terms of preparation for that certification exam by going through and taking, any subject, any question test style, or you can get really granular and pick certain materials. So, like Shannon was saying, sometimes we see these even utilized because you already have access to them, purchasing them for um, your team to get preparation for certification. Sometimes we'll see that departments actually utilize these to cover different topics or to kind of refresh on something that they're wanting to see their team look at while they're getting prepped.
Hey, Jenna, we do have a question from Danelle Clay. She's wondering in which country the servers are located for storing the user information for staff taking quizzes.
Wow, that's a good question. I do not know the specifics of where their servers are housed. We can get some insight into that. Shannon can make a note that we can look at that to get details. So I can get that insight for you and be able to get that back to you. Perfect. Okay, so um, just wanted to kind of wrap that up there. So creating a quiz, that's going to be the style of what you would do. Just to kind of show you what the interface looks like, I'm going to make myself a little one question quiz. Just to show you. So when you create a quiz for yourself, you'll see that you've got your question here in the center. It's going to be in that multiple choice style. And you'll have details over here on the right where you'll see when this question was last updated. And then you also have the ability to hover over the contributors to see what their specialty is and who they are, just a little idea as to who's working on these questions, the professionals in the field. So for this example, we're in that study review. So I'm going to go ahead and answer until I get this right, which it looks like it's going to take me a little bit more time today. And then down here at the bottom, I'll get a little bit of some content for myself. So I will have some teaching points, some key takeaways of what I just looked at, as well as an idea of how other people answered this. And then I also will have these link out articles here. So if I look down here at the bottom, I've got two different links here. One of them is going to be the StatPearls article that relates to this particular question, and the other is going to be that article's references linked out to PubMed. So you'll have those both there if you want to go through there and review. Like I said, some people we have where they're already studying for certification, and then they'll either see that there's a topic article and they want to look and say, hey, I want to know a little bit more about that, where they will be able to open that up and look at it, or they'll even have their team see that there's something that they want their entire department to look at, and they'll send them that way. So and I'll show you a little bit more of those articles here in a second. So I'll go ahead and submit this, and you'll get a little scorecard. Definitely not my best quiz. But then we can look at the transcript, which will give us a breakdown as to why we had certain things right or wrong, which topics that they were from. And then that way I can go back and review my material and be able to take different quizzes depending on the information I get, or even I can go back and retake certain quizzes if I make myself a couple big ones in preparation. Um, so that is going to be the process of creating the quizzes for yourself as a user. So if you're someone preparing, I do want to call out and I want to be conscious of time that there is an interface in here if you are a nurse educator and you've got a group you'd want to assign material to, or if you have, a new grad program like Shannon had called out, we have quite a few programs that utilize our tools almost to build out like a kind of crash course, get you started in the beginning of your new grad program. So you have the ability to assign content in here and then look at progress for your users. So I do want to call that out. That's something we can explore a bit more. But the interface is going to look really similar to the one that we're in now as if I'm a user. Quickly, I'm going to hop over to the articles and round out with the continuing education because it'll make a lot of sense. I promise there's a method to my madness. But the continuing education activities are going to really be centered around the articles and then answering with questions. So if you are familiar with how the article section and the question bank section is, the continuing education is really easy peasy to follow. So we looked at the critical care question bank and we saw that we were able to answer questions and have articles that corresponded. This is if you would like to really focus article first, question second, versus the quiz we looked at, right, was more a question first, article second. This allows you to go through, look at the articles that are available in here, and then it'll tell you the number of quiz questions that we have corresponding to that article. You'll notice that these vary because they vary depending on the topic and depending on how relevant the questions that we have about that topic are to your specialty in your group. And so you'll see that they vary question to question, but this is where you'd be able to go in, select a quiz, select an article, and then be able to complete the question afterwards. So here, if I wanted to look at this acute coronary syndrome, I could select the article, open that up. I'll have the article here, again, authors, editors, all of those good things that I can review. To avoid giving you all a headache, I'm going to scroll down to the very bottom real quickly. And you'll see in here that here are those PubMed references as well as a score based on how the evidence level. So I could go through and review this article and then take the 3 quiz questions that pertain directly to this topic if I wanted to focus on that specifically. And that leads me to the continuing education. So now that we've looked at the way that those 2 areas work, this is where they kind of marry together in the form of continuing education activities. So um, we have a variety of different continuing education activities in here that can be utilized. So there is content in here for a variety of different specialties, variety of different accreditation needs. So we're talking about specifically nursing today, which is going to be that we have a reporting system through the ANCC. StatPearls also does have a partnership with the ANA, so that's been a contributing factor to generating this content. But there is additional material. So if you're someone who oversees continuing education for your nurses and then also your, let's say, your physician associates, your nurse practitioners, well, you could build out material in here depending on your needs. But for now, let's take a look at the content we have specifically for nursing. So we have in here where you can sort based on the specialty that you would like to look for. So you'll see in here that we've got nurse practitioner as well as nursing, and these are all a variety of different specialties and topics and material that you may be interested in looking at for continuing education purposes. So, for example, if I pulled up infection control, you'll see that I've got a variety of different continuing education activities I can complete. I'll get an idea as to how long they would take in terms of hours, the number of questions, so those quiz questions we've been looking at. That's the way that you're assessed on the continuing education activity. So I get an idea as how many hours I should plan to spend in here and then how many questions I'm expected to complete. Um, I'll go ahead and open up just airborne precautions just to kind of show you all what this would look like. So if we were to say, I think that this is one that I need to complete, or let's say that my nurse educating team said, hey, I want everyone to go in and complete this activity. You'll see before you start the activity, you'll get a little bit of an idea as to what the activity is, how long you should anticipate to finish it, and then a description of the activity. The reason I want to stay on this page for a second is because I want to point out this method of participation and credit. Just because if we were to do this activity, we have to get the questions right before we can move on to the next one. And 5 questions in here, I don't know if I'm going to be able to do that as quickly as I want to for you all and keep you all on. So I want to point out that the process would be to register for the activity. So by selecting it, review this page that we're on right now, study the educational content, which would be the article that corresponds to the topic that we've taken a look at, that same style, and then answer the following test quiz questions that come from that particular article. So what we just looked at for if you're doing it for certification or self-study, that's the way that you would be able to utilize it to achieve it for CE for those activities. And then once you're done there, you complete a post-activity assessment survey about the survey itself, and then it will be able to report into your governing board to make sure you get credit for the activity. So um, that is kind of the design layout of these activities. I want to show you that we do have a section in here on your dashboard for the material that you've completed. So if you are wanting to keep track of what you've completed in here, or ones you've kind of started, or you've selected out that ones that you want to complete, on the left-hand side here, you'll have a section for your completed ones, where you can pull out all the certificates that you have. You can export them out so you have them outside of the system. And then in progress, this is all my ones that I've kind of popped in to start to look at. You'll see that you've got those listed out here as well. So everything living within one platform is essentially what the goal is with StatPearls. Any questions on that, or Shannon, any comments, concerns, favorite colors you want to add in as well?
No, I think that's great, Jenna. Just, we find customers using this platform for so many different reasons, from, the new graduates to nursing residency to professional development and cross unit training. So really kind of covers all of the various needs of your program, your nurses.
Awesome. Sorry, I'm just getting my screen ready for our next couple pieces because we're rounding out the end of the half hour. So, like we said at the top of the hour, we're doing a very high level review. So as you saw, we're kind of looking at the different areas, but if you wanted to see a little bit more as to what CE courses there are specifically, looking at those particular specialties, even spending some time in here to get familiar with the interface, and that's something we can definitely work on with you. So don't feel like this is the one chance you get to learn about these things and then you never get to hear anything again. We can definitely do more sessions.
Oh, and I should mention, now that we're on this page, that all of these products we're reviewing, they offer unlimited access for all of your users, but they are also fully a la carte. So you could just choose StatPearls, for example, and out of the 71 question banks, you could just choose one or two if that's what fits your needs, or the entire package.
Awesome. Thanks, Shannon. So the last two resources, hopping back to my handy dandy topics page for today, the last two resources I wanted to cover are going to be a resource called Ditki, and then a resource called Primal Pictures. Again, if I have any current clients on the call, these may be familiar in language to you. So I'm just wanting to quickly call out here, like I said, that these are going to be a little bit different than what we looked at with StatPearls. So StatPearls is going to have, the continuing education activities, specifically the certification banks, which, for all intents and purposes is a little bit more, I guess you could say, quote unquote, obvious to the user as to how someone would utilize that in a health system. Where we've seen some of these other materials that we have, like Anatomy TV and Ditki, um, are being utilized because they have such a wealth of types of content in there and visual content, mixed media material, that a lot of them started in the education sector of maybe the medical school attached to the health system or the nursing school attached to the health system. And they started to bleed over a little bit more to where we saw there was actual interest within the practicing side where we would have nurse educators who are having to build out these really extensive in services about certain foundational topics. They would get assessments on their teams for accreditation or for looking at Joint Commission, and they would see that there were areas that were more like foundational that they needed help with. And then they were having to build it all themselves. They were trying to find the content on Dr. Google, or they were to look at their resources, and they weren't having everything that they needed to build something. And so this is where I've been making some recommendations that people explore this area. I'm going to start with Ditki just because I do think it's a little bit easier for me to kind of briefly bring you in. Of course, it logs me out as I'm in my other places. But Ditki was founded by a neurologist by the name of Dr. Fish, and his entire focus on Ditki was to create content that allowed the user to really remember the material and not just sit in that short-term memory area. And so you'll see we've got a variety of different courses in here, but what I've seen in terms of building out continuing education materials or for there's educating teams for their departments when they're having to have their team look at certain things, they may find a topic within StatPearls that we looked at and then want to reinforce with a tutorial video in here. And so I'll call out specifically this pathophysiology for nursing. This is going to have material that really focuses on that pathophysiological aspect. And so you'll see we've got different tutorials. I made a search in StatPearls earlier for diabetes. You'll see in here that we've got treatments in the pathophysiology of diabetes in here. And so this could be something utilized for your group to take a look at. Um, the tutorials are anywhere from 5 to I'd say 15 minutes. They are shorter in nature, so they're not 30 seconds, so you're having to watch it over and over just to get the gist. And then they're not an hour because who has time to do that all the time? So I want to call out
You will learn about
that the look of these tutorials is intentional, where you'll notice that the material is all built out on the screen. And that's because Dr. Fish really believes in the concept of memory scaffolding, that when you have material popping in and off the screen all the time, you're not actually able to digest it. So everything stays on to build out this concept, taking small pieces together to build out a big, large foundational overview. And so, like I said, I see these utilized almost to kind of reinforce foundational topics with nursing teams. Shannon's called about new grad programs. The Ditki team will be able, they offer a service to actually look at, let's say it's an in-service schedule or a topic schedule of things that you really want to reinforce with your nursing team. Maybe you want to make sure that they have these certain foundational details. They know what content we have to support different clinical topics, and they'll help build custom courses for you, for your teams. So that way you can have them do that work for you instead of you having to go out and build out all these educational tools by topic, by session every week. Um, this is I do this every time where I'm like, I got 30 minutes, I have so much time, and then I talk so much, and then I'm nearing the end. So Shannon, anything on I guess really quickly before I ask Shannon, I do want to point out that there's also some quizzing functionality in here. So it's not just the tutorials. There's also some flashcards in here and that you can utilize for imagery. But one of the things that Ditki, which was previously Draw to Note, is really known for is this drawing pad. And so we're looking at the diabetes kind of breakdown view. And so it's going to be more of tables and charts, but some of the material in here is a lot more on different structures and the actual look and feel of those views. Where this functionality of being able to either label a diagram or follow along with the video and draw the diagram is a really good way for your team to be reinforced with those materials because it adds that kinetic learning piece that so many people crave that we're not seeing as much anymore. Shannon, anything on that that you want to call out?
Just that it's a very affordable resource, and the curriculum mapping or the content mapping, as Jenna mentioned, is free with your subscription as well. And, you know, Dr. Fish really connects the scientific concepts to your clinical practice. And he's covering all those really important foundational sciences that the nurses need, like anatomy, physiology, pathophysiology, and so forth. Um, so that's really all I have to mention.
Awesome. Well, and then the last little bit I want to call out, and I'm just going to stay on this welcome page really briefly for our last resource, which is going to be Primal Pictures. And so this is also known as Anatomy TV. And this is going to be content that is more focused toward anatomical material. So it's going to be models, videos, imaging, MRIs, CTs, things like that. But one big thing with Anatomy TV and Primal is that what their differentiator that they really take pride in is that they're very medically accurate. So everything in here is built off of real scan data, making it really reliable for those who maybe go into some type of procedural nursing and they want to make sure that the content they're looking at is really accurate. So you'll see that there's a couple different sections on here: models, dissection, imaging, different clinical content, physiology, muscle function, learning and assessment, guided learning. I could go on, but I want to point out here specifically that we're seeing a lot of the models and the content in here used to generate anatomical views in corresponding with, like I said, maybe things like IV placement and procedural preparation. And so you have the ability to kind of take certain content in here and make it what you want and what you need. There also is a diseases and conditions module that focuses on the actual pathological implications of conditions, and then the treatments, the causes, kind of the next steps, all of that's in there for you to be able to review. And then lastly, there's a really strong anatomy and physiology element in here. And I know that that is something that is expected for your nurses to come in and have taken as a prerequisite and be reinforced. But we're just hearing from our current clients that that's just not always the case, that some of those foundational concepts have really stuck. And a lot of it was more memorization for school. And so it's a good way to make sure that your entire group, whether it's a new grad program or just kind of checking in on the foundational knowledge of your team, that they're brushed up to where you're wanting to see them. So again, we can spend some more time if you're interested breaking down the different modules in here, but as a high level overview, variety of different types of content that you can use to build out educational tools. I'm officially 1 minute past my allotted time, so I'm definitely cheating like per usual with me in these sessions. So if you have to hop off, we'll probably spend the next 2 to 3 minutes closing out. So we'll get the recording out to people. We'll cut out my little small talk with Shannon the first 5 minutes, and that way you all can review and refresh it for later. But wanted to kind of, I said it along the lines was we were going through as, you know, maybe looking at tutorials and assigning StatPearls articles for review. So you're able to really use this content together. That's one of the reasons we offer a variety of educational tools, is so you can build things that you want, not just marry yourself to one platform. And so like Shannon said, from the a la carte perspective with StatPearls, you also can build custom packages across our different product thresholds. So if you want to add certain materials from certain things or start with certain stuff, you can, and then you can make changes as you need. I'm going to let Shannon close this out because we do have some conference attendance happening with our team members in the next couple of months. And then I'll also, while she's doing that, let people, if they have any last minute questions, pop those in and we can cover those right at the end before we finish up. So, Shannon?
Thanks, Jenna. So lastly, just to close this out, we are going to be at the Magnet and Pathway Conference, October 8th through the 10th in Atlanta, Georgia. So please swing by and say hi, chat with us, and we'd love to see you and hear from you. And then I know, as we mentioned early on in the session, this was a very broad overview. So we love to be able to meet with you briefly to learn more about your nurses and maybe your resource needs. And we can fully customize any of these resources to fit your needs and budgets. So I did drop my email in the chat. And then after this session, you will receive an email from us with the recording link and so forth. And you're just welcome to reach out and set up a time to chat a little bit more with us.
Awesome. Thanks, Shannon. Wanted to 30 seconds if anyone has anything to add. So please feel free. If not, like Shannon said, our emails are in the chat for you to reach out if you have anything. Anything that we can do to support, we're here. So I do want to say that Shannon gets to be the good guy to if you want to set up a one-to-one session so she can walk you through what we have for purchasing, but also want to reinforce that if you elect to purchase these materials with us, we don't just say, okay, great, thanks for handing us your money and send you on your way. You get handed back to me, and then also in collaboration with Shannon and the other reps that we have. We do a full onboarding process to really train and teach your group. So whether that's hosting sessions, giving you collateral, marketing materials, we are here to take that work off of you. So just know that we've got those supports there. And like Shannon said, if you have any questions, please follow up, and we're happy to host more sessions to really break this material down.
Absolutely. Thanks, Jenna. And really, thank you, everyone. We appreciate your time in joining us, and we definitely look forward to hearing from you and helping with anything you might need in the future.
Thanks. Hearing you and hearing from you. We want to do both of those things.
Oh,
So
yeah. Yeah. You
just
know what I
kidding.
meant.
Thanks, everyone. Have a great rest of your day. Bye, all.
Everyone, have a good day.